The final impression materials are made up of two parts, a base and a catalyst. Once they're mixed together, they begin to set up. Many situations require using two different types of impression materials together. First, a thin paste is placed into tight areas to capture the finer details of the teeth and gums. And then a stiffer putty within the impression tray sticks to this paste and makes up a bulk of the impression. Delivering the impression materials to the trays is easiest when using the syringes. These automatically and quickly mix the two parts. Syringed materials set quicker, giving the doctor less time for placement, however. Alternately, equal lengths on a mixing pad of the two parts from tubes might be used. These are mixed by hand for 30 seconds or more and set in 5 to 10 minutes. There are also putty-like materials, kneaded together by hand. These set up quickly, like the syringed impression materials. As with so many other procedures, we've said that the most important step is the one that you're doing now. In the prosthodontic care, this is most true with the final impression stage. Be sure to follow the manufacturer's instructions and never intermix brands of materials. It simply won't work. And remember to use tray adhesives. While failure in any step is distressing to both you and the doctor, it's the patient who ultimately suffers the most, the victim of delayed care, or at worst, an ill-fitting denture or partial. You'll see many different names for final impression materials, from rubber-based to polyvinyl siloxane. Some doctors enjoy great success with zinc oxide and eugenol materials. Follow your dentist's lead and acquaint yourself with the materials mixing and use instructions. Second in importance to the accuracy of the impression is the bite registration. This is the creation of the relationship between the upper and the lower models, determined by how the teeth normally hit against each other. Some doctors can get a good bite registration using wax. Others use a syringed silicone material. Once hardened, it must be treated delicately and not distorted. Otherwise, the lab will mismount the models and fabricate the prosthesis to this inaccurate jaw relationship. The only way to develop prostheses that function properly relative to a patient's jaws is through the use of an articulator. These artificial jaws hold the dentures in a relationship that mimics the patient's own jaws. Your dentist may use his own articulators, or the laboratory may supply ones that they work with the best. In order to properly float the mounted models in the space of the articulator within angulations that most match the patient's jaws, a so-called face bow transfer must be made. The face bow locates a reproducible plane that's made up of a tripod, usually the ear openings and the top of the nose. It transfers these to the articulator. When replacement teeth are then fabricated using the articulator, the teeth move and function in a manner most similar to within the mouth. Finally, the denture teeth themselves must be selected. Many patients think this is the most important step, and in some ways it is to them. Often they'll want them too white, or they'll want them too small or too tightly spaced. The dentist's job is to help them select teeth that most closely mimic their natural ones, but in a pre-disease state. The shade guide to select the tooth color is brand specific. Its shade numbers and letters should be used with that brand of teeth. Certain shade guides, like the Vita brand used in restorative dentistry, are becoming standards in some areas and with some laboratories. Be sure to use shade guides provided by the lab or by your doctor. The shape of the denture teeth is best chosen by the dentist. It represents a cross between function and form. There really is no one-size-fits-all denture tooth. Every person is different, and like every snowflake is also different, so is every tooth. The actual process of making a removable prosthesis involves 5 treatment steps. The preliminary workup, the preparatory appointment, the try-in visit, delivery of the prosthesis, and of course, adjustments. Your role in direct patient care is much more relaxed than in other elements of dental assisting. For example, moisture control and evacuation is less critical. On the other hand, your laboratory responsibilities are heightened, as in pouring the impressions in stone and trimming them, packing lab cases, and so on, and you must also manage the patient's return appointments, making sure that the case is back from the lab in time for the patient's visit. The preliminary workup follows the examination and the treatment presentation visits. At this preliminary workup, preliminary impressions are made. These are usually both upper and lower alginates, poured in colored dental stone. The color, shape, and size of the denture teeth may also be selected at this visit. The models made from these impressions are used to make custom impression trays, and if just one arch is being treated, the opposing model is not used in making a tray. It serves as the opposing teeth to the prosthesis. When pouring the stone models, take care to not trap air bubbles. Mix the stone according to the instructions and carefully vibrate it into the impression. If your office uses model trimmers, you may form a patty of stone on a tile or other type of pad and place the impression on this. Then, trim the set stone in the manner shown, or as directed by your doctor's wishes. Notice how the upper model on the left is trimmed. The back is flat, and the sides are parallel to the bicuspids. The front of the model is shaped to form a point between the front teeth. The rear corners are flattened in. The lower model is trimmed similarly, but with the front rounded in contour with the teeth. Be careful to always stay at least 1/4 of an inch away from the teeth. At the preparation appointment, a variety of treatments may be needed. Unneeded teeth may be extracted. Enamel may be shaped for more ideal conformity to the prosthesis. Root canal therapy may be included. At the very least, final impressions using custom trays and the bite registration are made at this appointment. If the patient is wearing an existing prosthesis, have them give it to you and place it in a denture cup with water. Discourage the patient from simply wrapping it in a paper towel. This both dries it out and can also endanger it through inadvertent disposal as trash. As your dentist prepares the patient for the impression, both verbally and with gauze and such for dryness, you'll mix the impression material and load the tray. If a thinner wash is to be used, mix it first and load the syringe. While the doctor injects it into place, mix and load the tray as shown here. Make sure you've coated the custom impression tray with adhesive and that the impression tray is completely blended. Once set, the dentist removes the impression and checks it for accuracy and completeness. It's not unusual to have to repeat the procedure. It's simply that important. The finished custom impression is contaminated with saliva and maybe even blood, so it's considered a biohazard. Proper management assures your safety and the safety of the lab receiving it. They're depending on you, too. So place the impression in a resealable plastic storage bag, being careful to not touch its outside. After the patient is dismissed, you can prepare it for sending it to the laboratory, which we'll discuss shortly. The face-bow transfer and the bite registration are usually made last, since they're of little use if you've not yet gotten an acceptable impression. Some states have laws that allow the dental assistant to perform the Facebook transfer. Specific training is needed. Otherwise, have the proper materials unique to your Facebook and articulator available for the dentist's use. Once the selection of the teeth has been made, the bite registration completes the appointment. Again, the material used depends on the doctor's preference. Here, a firm setting material is being placed on the teeth for the patient to bite down into. Once the impressions, the bite registration, and the Facebook transfer have all been gathered, they must be prepared to be sent to the dental laboratory that will be making the prosthesis, along with a written prescription for what's wanted, if the work is not being done within your office. Bite registrations and the final impressions must be disinfected before sending them out. Wearing personal protective equipment, remove the items from the plastic bag and gently rinse them clean of blood and saliva. Lightly air dry them, and then immerse them or spray them with a germicide specifically made for this purpose. Be sure to follow the instructions. It's a good idea to write the disinfection process on the prescription. Group and package the items by patient, carefully in their own clean plastic bag. Avoid bending anything. Put them all in a box and lightly fill it with polystyrene peanuts or bubble wrap, and when done, remove your personal protective equipment and wash your hands. And don't forget to include the lab prescription. A paper trail is imperative for monitoring the many lab cases you'll have going at one time. Fill out the prescription completely and keep a copy of the prescription grouped alphabetically in the lab. Many dental practices also keep a third copy in the patient's record. The treatment area is cleaned and prepared for the next patient in the usual manner. The laboratory must also be cleaned and disinfected. Maximal attention to aseptic technique must always be carried with you into the laboratory. Once the case is returned from the dental laboratory, the patient is scheduled for a try-in appointment.